Tonight on KQED Newsroom, the Republican-led Senate acquits President Trump of impeachment charges as the Democratic presidential race heats up. Also, we'll hear from an infectious disease expert and a member of Congress about halting the spread of the coronavirus, which has prompted travel bans and mandatory quarantines in the U.S. and abroad. And a new KQED radio documentary reveals how mental health struggles of motherhood can have tragic consequences. Good evening and welcome to KQED Newsroom. I'm Marisa Lagos. We begin tonight with the conclusion of President Trump's impeachment trial in the Senate. On Wednesday, the Senate voted to acquit President Trump of obstructions of Congress and abuse of power. Mitt Romney was the lone GOP lawmaker to join Democrats in finding him guilty of abuse of power. The next day, President Trump appeared at the White House to celebrate his acquittal and denounce Democrats and the investigations that have dogged his presidency. President Trump also delivered his third State of the Union address on Tuesday night. He claimed credit for the strong economy and vowed to, quote, never let socialism destroy American health care. The issue has taken center stage in the 2020 presidential race. Here to discuss this are Politico senior writer Carla Marinucci and NPR senior editor and correspondent Ron Elving. He joins us by Skype from the nation's capital. Welcome to you both. Ron, let's start with you. We are hearing today that Lieutenant Colonel Alexander Vindman, who and his twin brother are being fired and removed from the White House. He was one of the witnesses called during the impeachment investigation. He provided very damaging testimony against the president. What does this firing tell us about how Trump's going to act moving forward? And could there be any repercussions for the president or his administration?
You know, there were two theories on the part of the senators who were voting on impeachment. One was that the president was going to have learned his lesson and that he was going to moderate his behavior. That does not seem to have been borne out by his behavior thus far at the prayer breakfast on Thursday or at his victory lap speech in the East Room, or now today as he has begun, and we don't think he's finished, cleaning out some of the people that he thinks betrayed him in the impeachment proceedings, including Lieutenant Colonel Vindman and his brother, who was actually on staff over in the Senate for some other people, but seems to have lost his job in the same hour.
Carla, I mean, it's not just the president that could potentially suffer repercussions. We have senators like Susan Collins from Maine who had said she hoped the president would learn lessons. She is one of a handful of senators that Democrats hope to defeat in November. What do you think this means for them?
Look, I think it's going to fire up the Democrats. They are already donating in record amounts to the opposition in all of those cases. Whether you talk about Collins, you would talk about Martha McSally. But it's going to keep the Republicans fired up as well. Right. This whole week is an example of the kind of, a rancor and hostility we've seen between the parties that is not going away anytime soon, and it's going to extend probably beyond the next election. I think we've gotten the evidence of that this week.
Yeah, it definitely feels like we are already in this election. Ron, I want to bring you back in here. The impeachment vote was on Wednesday. The only person who you could say maybe didn't act in a partisan manner was Utah Senator Mitt Romney. He was the sole Republican vote on that first article of impeachment on abuse of power. Do you think that that in any way robs Trump of this talking point, that this was a purely partisan witch hunt?
It doesn't seem to have deterred him from using exactly that language. But it does add a note, an asterisk, if you will. Mitt Romney was the first person to vote to remove from office a president of his own party. We've had party lines stepped over in the past in previous impeachments, but always to defend someone, not to remove them. So he does become a unique voice in all the history of impeachments. That's not something we're going to hear from the White House. The White House is, in some senses, trying to ignore him, but has also made some rather direct shots at him hiding behind his religion or using religion as a crutch, because he mentioned his Mormon faith when he gave the speech on the floor, and it was quite an emotional speech about why he felt he had to follow the facts that had been presented to the Senate and vote for the president's removal from office.
Carla, do you think there could be any political repercussions for Romney? I mean, obviously, he has a target on his back when it comes to the White House.
Look, his own newspapers in Utah have stood up for him, but there's no question about it. There's going to be political repercussions for him and for his state. And that's, I think, got to be of concern to him. The president has already mentioned as such. But I think that he's getting support from Democrats. It's interesting to watch. But it was also interesting to watch the silence that came out of the Senate, people that had known him for years, people who have respected him for years, have not come forward to affirm for him in any way. So I think we're going to see how this plays out. But he's willing to take the heat. He made that clear.
Definitely. This week, Ron, we did see the President give his third State of the Union address. We've seen presidents dating back to Ronald Reagan use that as a way to honor Americans who have distinguished themselves. This speech seemed to take it to a new level when it came to both that and some of the sort of reality TV sort of vibe to it, the rancor, the partisanship. What was the reaction like to it in D.C.?
Well, we haven't stopped talking about it, even with everything else that we have to talk about. People are still talking about Trump snubbing Speaker Pelosi by not taking her hand when she stretched it out to greet him when he arrived. And of course, then she dropped the usual honorific way in which the president is introduced and just said, "I present the president." And then, of course, most dramatically, the ripping up of the speech. But along the way and in between, we saw all those dramatic moments, all those sympathetic people in the gallery getting some kind of recognition from the president, many of them people of color, African Americans, the president reaching out, campaigning, if you will, but nonetheless doing it in a way that was more inclusive than he usually is. But then, of course, he gave the Presidential Medal of Freedom to Rush Limbaugh right there in the gallery, right before everyone, having Melania hang it around his neck. There's probably no way you could stick it to Democrats and liberals around the country more determinedly than by doing that with Rush Limbaugh. Of course, he has been diagnosed with stage 4 cancer, and so he is a sympathetic figure in that respect at this particular moment. Nonetheless, it was not a cheer that went up from both sides of the aisle.
Definitely not. And Carla, obviously, Nancy Pelosi had the last word there with that ripping of the speech. But I want to move on to the Democratic presidential race because, of course, we did have the Iowa caucuses this week.
That's right.
We may never really know the full sort of outcome of those, given the debacle there. But we've seen both Pete Buttigieg and Bernie Sanders declare victory. Let's call it a dual victory for our purposes.
That's right.
What does the strength of those two very different candidates tell you about where this race is right now?
I mean, right now, I think the shock there was the performance of Joe Biden, and that has opened up a moderate lane that obviously Pete Buttigieg has taken going into New Hampshire. And we're going to look at how this plays out in California as well. This opens up also an opportunity, I think, for Michael Bloomberg. He is absolutely looking at wrangling those moderate voters, and he's playing big time in California. He had the state all to himself while they were playing in Iowa and New Hampshire. So I think the Buttigieg-Bernie debate is going to get more and more heated. And as it comes into California, people are already voting here. 15 million ballots went out this week, more votes than in the first 4 states combined. So this is going to be a place where they're going to throw down, and we're going to see how those moderate and progressive lanes work out.
Ron, I mean, as Carla said, people are already voting in California. We have New Hampshire, South Carolina, Nevada still to come. Where do you think things stand for people like Joe Biden and Elizabeth Warren, who looked so strong just a few months ago?
Yes, they both seem to be in the front rank of these candidates, but now both of their candidacies are to some degree in question, maybe even on life support. Joe Biden needs to have a stronger showing in New Hampshire than the polls are indicating he will have. If he doesn't, it'll be tough for him to bounce back in Nevada and even in South Carolina, which has been his firewall because of his popularity with African American voters who are dominant in that Democratic primary. So it's very tough for Biden, and it may be his last chance in the next 2 weeks to get back on the winning side, and it looks like a really heavy lift. Elizabeth Warren may benefit to some degree by people stepping back and saying Bernie Sanders is too socialist, too frankly, admittedly, gladly, embracingly socialist for the larger American public or even for the larger Democratic voting public. So she still has a lane to run in, but she has to recover that momentum. As you've noted, she's lost.
Carla, quickly, you mentioned Michael Bloomberg. He has skipped these early states, betting on California. How's he looking?
Absolutely. Up and down California, his events have been filled with people. The money is there. It's huge. 300 people he's hired on, 20 offices in the state. He has got a ton of endorsements here, so he is going to be very aggressive and someone to watch in California. All
right. Carla Marinucci of Politico, Ron Elving, NPR. Thank you both so much.
Thank you.
Thank you.
Concern mounts over containing the coronavirus epidemic. The illness has been found in more than 24 countries, infecting more than 31,000 people. Most of the confirmed cases are in China, the epicenter of the outbreak, where more than 600 people have died from it. Here in the U.S., there are 12 confirmed cases, including 4 in the Bay Area. Last week, health officials declared a public health emergency and announced drastic measures to contain its spread, including barring entry to non-U.S. citizens who recently traveled to China. Joining me by Skype from Washington, D.C. is California Congressman and physician Ami Bera. Congressman, thanks for joining us.
Glad to be on. Thanks for having me.
So as I mentioned, you are both a doctor and a lawmaker. You oversaw a hearing this week on this epidemic. Can you talk about how you want to be communicating to the public in terms of being vigilant and aware versus not causing panic?
Sure. I think it's important for our public to understand that while there's a risk, right now the relative risk to Americans is pretty low. In addition, we're being very vigilant here. So, our CDC has personnel working with hospitals around the country, making sure they've got the latest information. Our public health professionals are doing routine screening as travelers return and folks show up with symptoms. So we're doing a great job. That said, this is rapidly evolving.
Yeah, I mean, a week ago, we saw the Trump administration implement what some people saw as sort of hasty travel restrictions around banning non-U.S. citizens who are returning from China, quarantining people who are American citizens who are coming from the region where the outbreak began. What's your sense on whether that was rolled out properly and how effective it is?
I think it caught a lot of public health officials like myself and even the administration's own public health officials off guard. One of the things that came out of our hearing this week was travel bans like that are not going to be very effective. In essence, you still have a lot of goods and services and planes arriving from China. We know this virus is no longer confined to a particular region because it's showing up in lots of different countries. So you can't ban all travel from everywhere. So there's better methods. We ought to very quickly come up with better diagnostic tools so we can do rapid diagnosis, et cetera. And the travel ban probably isn't going to work.
What would you like to see the Trump administration do that they haven't so far?
Our first recommendation to the Trump administration is to use every tool and resource to make sure we get our CDC, public health officials, epidemiologists to the epicenter in Wuhan. We've got the best trained people in the world, and that's how we can get the best information. Secondly, what we learned from the 2014 Ebola crisis was you have to have a real command control structure. Multiple agencies are going to be involved in the response. You've got to have a single individual in charge here that can coordinate across agencies, as well as this is an international response. So is constantly in communication with the rest of the world.
What do you think is the most sort of concerning thing right now in terms of containing this virus? Is it how the Chinese government is dealing with it, or is it what you talked about, which is just how global the world is in terms of travel these days?
I think it's a little bit of both. The fact is the world is interconnected and people travel and goods and services move around the world pretty quickly. I think the real concerning thing right now is we don't have the best information in terms of incubation time, in terms of how easily it's transmitted from human to human, in terms of can you transmit this when you don't have any symptoms, or are you only infectious when you have symptoms? That's why it's really important for us to get our personnel into China at the epicenter, to study it, to understand it, to do all the contact tracing, et cetera, so we know exactly what we're dealing with.
What's your sense on how cooperative the Chinese government is being in terms of letting Americans and other nations send their scientists there?
CDC's been asking for several weeks to send personnel there. Chinese have been slow to respond. My understanding is President Trump had a conversation yesterday with the Chinese premier. Hopefully the Chinese will work with us more closely. Again, we've got the best personnel, and this isn't criticizing China. It's just this is now a global epidemic or pandemic, and we all should be working together to figure out how best to get ahead of this.
Before I let you go, we have heard some troubling stories really from around the globe about discrimination against Chinese people. Can you just talk about your message to the public when it comes to that type of thing?
Yeah, my message to the public is this is a virus. It doesn't know ethnicity. It doesn't know culture. It doesn't know where that person was born, whether in China or here in the United States. And we've got to make sure we don't overreact, and it's never appropriate for us to single out a particular ethnic group.
All right, Elk Grove Congressman Ami Bera, also a physician, thank you so much for joining us.
Thank you for having me on.
This week, the Centers for Disease Control started shipping out coronavirus test kits to labs across the U.S. as scientists work around the world to develop a vaccine for it. Joining me now is Dr. Charles Chu, an infectious disease expert and professor at UC San Francisco. Dr. Chu, thank you so much for being here.
Thank you.
Very busy time for you. I want to start, can you just explain to us what is coronavirus and why is it so dangerous? It feels like when you hear about the symptoms, they're almost benign this time of year. A runny nose, a fever. What is it about this disease?
Yeah, so coronaviruses are actually a part of a group of viruses which are known as common cold viruses. Okay. And these are the seasonal viruses that you see year after year. The symptoms that you would get include fever, nasal congestion, runny nose, cough. But as for coronaviruses, along with other viruses, a subset of patients or some individuals may get very sick from these. So most people will do fine. They'll just have a minor upper respiratory illness. There are some people, though, will get sicker, and the coronaviruses can cause a pneumonia that can become life-threatening.
So in this case, it feels like we are hearing about not necessarily the highest risk patients getting sicker. Is there something about this strain that makes it more virulent or dangerous, or do we know yet?
Yeah, I think one thing is that we have to distinguish this coronavirus from the seasonal human coronaviruses. So we have a total of 7 known coronaviruses. 4 of them are seasonal. These are coronaviruses that we see year after year. In fact, it's actually thought that these seasonal coronaviruses comprise up to 10 to 30% of all respiratory infections. So all cases of the common cold, 10 to 30% caused by coronaviruses. This is a new virus. This is a virus that, as best as we can tell, arose probably in early December, late November, but early last year, very recently, there was an animal-to-human transmission event. It occurred in the city of Wuhan, China. And so this is a virus that really has never before been seen in humans. And as a result, I think that there's been more concern about this because there's a lot about this virus that we still don't know.
Yeah. I mean, you've been working on a rapid diagnostic test. I know just diagnosing people has been a challenge. How close do you feel like you guys are? And is that something that we would share with the Chinese government?
Yeah, I think it's really important for us to develop rapid diagnostic tests. Now, the CDC has a test that they are running for screening for patients or individuals returning from China who may have been infected. So this is a test that typically if you have a patient or if you have an individual who may have symptoms, may have been returning traveler who may have been infected, the sample gets sent, which is usually a nasal swab. You usually take a swab from your nose. The sample gets sent to the CDC. You get an answer in about 24 hours, within a day. What I do think, though, is we're working on a test where we can get an answer within 1 hour. I want to develop a test that you could actually take the sample and perhaps do the testing at a patient's bedside or in the emergency room, or even in the future, say at an airport where you want to screen patients who may have been exposed or returning from China.
So how close are we?
So we actually have the test working, but it's working currently in the research laboratory. The next step is to test it in a clinical laboratory and to also engage with the FDA, Food and Drug Administration. The FDA approves all of these diagnostic tests, but they do have a fast-track pathway, especially for urgent public health care needs, such as diagnostics for this new coronavirus.
What about a vaccine? I know that's something that's also being worked on. Do you think that would be possible to have a vaccination for this virus?
Yeah, certainly. There's been a huge drive for a vaccine because vaccines are really our best way to prevent viral infections, especially because these viral infections, they can be so ubiquitous. And as you know from the influenza vaccine, even a vaccine that's not 100% effective every year is still helpful, can still help decrease the number of infections. Yeah. So there's been a lot of interest in the vaccine, and we do have some experience from the SARS outbreak, which occurred in 2003. We have some experience. There was a SARS vaccine that was actually developed developed, but it was never used because the SARS outbreak was over. I suspect that there will be more opportunity for vaccine developers this time around because already this new coronavirus has caused more cases, many more cases than SARS.
So in the meantime, we are seeing mandatory quarantines as a way to prevent the spread both in the U.S. and abroad. Do you see these types of quarantines as an effective way of halting the spread of this disease at this point?
The short answer is it's unclear. Okay. We don't know whether or not the quarantines that, for instance, that China is placing on extensive quarantines across, they've closed, for instance, the entire city of Wuhan. There's extensive quarantines that prevent travel to and from different locations. It's unclear whether or not quarantines are going to be able to stop an outbreak like this. I think we'll probably know in a few weeks, but there has been kind of a hit or miss issues with quarantines, and namely, once you put a quarantine in place and you prevent travel, you also prevent kind of the badly needed medical supplies, resources that you might need to actually address the outbreak and prevent it from spreading any further. So it remains to be seen. It really is a double-edged sword.
All right, Dr. Charles Chu of UCSF, thank you so much.
Thank you.
A new KQED radio documentary explores the tragic story of Carol Coronado. In May 2014, she killed her 3 daughters, ranging in age from 3 months to 2 years old. During the trial, her lawyers argued that she suffered from postpartum psychosis, a rare medical condition that can sometimes lead to deadly violence. The case highlights how the legal system in most of the U.S. hasn't caught up with the medical science, while a recent law passed in California now requires screening of new moms for postpartum mental illness. Joining me now is the producer and reporter of this story, KQED health correspondent April Domboski. April, thank you for coming in.
Thanks for having me.
So your story documents this heartbreaking story. Tell us a little bit about Carol Coronado and her husband, Rudy.
You know, they were really a normal couple. They met in a donut shop in Carson. They both loved the Dodgers. They fell for each other pretty quickly. They got married and had kids pretty quickly after that, 3 daughters in less than 3 years.
Wow. Carol is now serving a life sentence in prison. You talked to her several times during your reporting at that prison in Chowchilla. Tell us if you think she understands to this day really what happened.
I think in some ways it's still a mystery even to her. You know, the doctors believe she had postpartum psychosis, and what's common with psychotic experience is that your brain isn't really working. And so, you know, your thoughts aren't forming A, B, C, D. It's A, G, D, M. And so your memories can be really hard to form memories in that way. And so for Carol says she doesn't remember anything from that day. So it could be because of what happened. She was in this psychotic state. But also, you know, Carol seems to me also quite detached from what happened, and that can be pretty common with a very traumatic experience, which for her this clearly was. She loved her children, she loved being a mom, so this is extremely difficult for her. So
does she understand that they're deceased even?
I think she does. She rationally knows that that's true, but sometimes I talk to her, she still talks about them in the present tense.
Wow. I think people are becoming more familiar with postpartum depression. As I mentioned, there's been legislation passed to actually screen for that. Talk about the difference between that and postpartum psychosis. Are they related?
They're related in the sense that they both occur after childbirth. They, you know, doctors believe they're caused by hormonal changes related to childbirth, but they are 2 different conditions. So postpartum depression is more common. About 1 out of 5 women will experience that. Postpartum psychosis is more like 1 out of 500. Okay.
Which is still not that unusual.
And doctors, you know, some doctors actually think it's an undercount because of the symptoms. You know, the symptoms are not like classic psychosis with hallucinations or paranoia. In postpartum women, it's more confusion, these disorganized thoughts that I was talking about. And so, and because the symptoms can wax and wane, doctors sometimes miss it.
Right, and family members. I mean, this story really
Absolutely.
details that there were some signs. How widespread is actual violence?
So the violence is really rare. It's important to know that postpartum psychosis and depression, they're both treatable. So with medications and therapy, it will go away. But if left untreated, it can become very severe very quickly. And what happens is that, a lot of moms might feel at some point or another like they're a bad mom. But
Or overwhelmed. Yeah.
But if you're psychotic and delusional, then that delusion becomes a fixed belief. And so some of these moms actually truly believe they're a bad mom, they'd be better off dead. And then sometimes that extends to, well, maybe my kids will be better off with me in heaven.
Wow, so heartbreaking. I know you worked hard to analyze state prison records and found that there's likely more than 100 women in state prisons serving sentences for killing their children, the vast majority of them in the first few years after those kids were born. Talk about why they're in prison and how state law defines insanity and murder in California.
So insanity is a legal term. The definition that we use in California was written in 1843, and it says that a person is insane if they can't tell the difference between right and wrong. But our understanding of postpartum mental illness is, much more recent than that. And a lot of doctors, as I said, don't always recognize the symptoms of postpartum psychosis. It's only become mandatory to screen for it in the last couple of years. And so, the law doesn't fully capture, the understanding that we now have of some of these conditions. And so it still gets filtered through this, sort of moral test, right and wrong.
In Carol's case, was she even allowed to introduce that evidence in her trial? She couldn't.
She did. She did present evidence of postpartum psychosis, but the law is so narrow the way it's written that there isn't a lot of latitude for how judges can interpret that.
So other countries do treat this differently. Can you tell me if you think that there's any chance that we could change state laws here to more mirror what we see in the EU and other places like that?
Well, some health advocates are changing. So in other countries, they treat these offenses as a totally separate category of crime. So it's considered more manslaughter as opposed to murder. I think the U.S. is pretty far from reaching that, but there are some steps that some states are trying to take where they can allow postpartum mental illness to be a mitigating factor and possibly even, just reduce the sentence a little bit.
All right. Health correspondent April Demboski, we will keep an eye out for the rest of your reporting. Thank you so much.
Thanks, Marisa.
You can hear April's radio documentary at thecaliforniareport.org. That'll do it for us. As always, you can find more of our coverage at kqed.org/newsroom. I'm Marisa Lagos. Thanks for joining us.